Good afternoon, everyone. It's 2 o'clock. Thanks for joining us for today's briefing. On the panel, we have Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Shannon Grauman, Data Analytics Manager for the Milwaukee County Office of Emergency Management, and Darren Roush, Health Officer and Director of the Greenfield Health Department. Mayor Barrett, you're up first.
Thank you very much, Sydney. Good afternoon, everyone. Some good news to report. This week, the federal government under President Biden's leadership opened a new open enrollment period for the Affordable Care Act that runs through May 15th. So what this means is anyone who missed the last deadline to sign up in December now has another chance to shop for an affordable plan in the health insurance marketplace. And for those who currently have a marketplace plan but think that a different plan might be a better fit, you can switch coverage now instead of waiting until the fall. I think we all recognize that health insurance can be very, very confusing, but free help is available to anyone who would like to learn more about their options, whether it's the healthcare marketplace, Badger Care, or Cobra. And getting connected to an expert is easy. Just call 211, visit healthcare.gov, or check out a brand new user-friendly website, whizcovered.com, whizcovered.com. Why is this relevant? This is relevant because more than 60,000 people in Milwaukee County were uninsured before the pandemic, and that number has grown as people have been furloughed or had their hours cut or have lost their jobs entirely. That's why it's so important that everyone knows that they are very likely to find affordable health care coverage for themselves and their family. Our goal is to make sure that people have healthcare. I think healthcare is a basic human right, and I want to make sure that we are doing everything we can so that people can have access to healthcare. In the Milwaukee area, 8 out of 10 people who sign up through healthcare.gov receive financial help, such as subsidies and tax credits to lower their monthly premium. This is also tax time. So as individuals prepare to file their income taxes and are reviewing all their finances from the past year and looking ahead for what's ahead in 2021, this is the perfect time to consult with a health insurance expert to learn more about health coverage options. Once again, you can call 211 or visit whizcovered.com to find free expert help with health insurance during this new special open enrollment period. Now for a COVID-19 update for testing. On yesterday, Wednesday, February 17th, we had 521 people tested at American Family Field, 79 at the Northwest Health Center, and 78 at the Southside Health Center. Continue, please, to follow the 3 W's: wear a mask, wash your hands, and watch your distance. And most importantly, if you are feeling ill or think you may have been exposed to someone who has tested positive for COVID-19, please do not hesitate to seek out free community testing. That's why it's there. We want people to take advantage of this. And so that's why we've got multiple sites for people to be tested. I also want to take a couple minutes because we've got a number of businesses and other entities that are interested in the City of Milwaukee's safety plan. And the reason this is important is because the Milwaukee Health Department is focusing considerable attention on reviewing safety plans. And there are a number of them in the queue right now. The process can take up to several weeks, and we've got a lot of people, a lot of organizations that want to have their safety plan reviewed. So my strong advice is get it in as quickly as you can, because we want to make sure that we're serving everyone in this community. Bear in mind that the review requires a give and take with the applicant and on-site visits. Earlier this week, we talked about the Bucks plan, and that's a perfect example where there was very solid give and take with the Bucks, and there were on-site visits to make sure that that was working appropriately. Traffic flows, customer interaction, and how customers conduct themselves are some of the biggest considerations that we look at. But the most important priority is preventing the spread of the virus. Venues can get more information at milwaukee.gov/MMFS/entertainment venue. Bars and restaurants can get more information at milwaukee.gov/MMFS/safety plan. Or you can submit a plan and ask a question in an email at cehadmin@milwaukee.gov. Again, as I said, the safety plan for the Milwaukee Bucks is a perfect example of how a venue and the health department can work together in a really constructive way. From the onset, the Bucks prioritized safety. They were thoughtful and quick to respond to questions and recommendations. But I want people to know that the individuals at the Milwaukee Health Department are working very, very hard on plan reviews and so many other aspects of addressing the pandemic, and they deserve recognition and appreciation for their efforts. So with that, I'm going to turn it over to our partner, County Executive David Crowley. Mr. County Executive.
Well, thank you so much, Mayor Barrett. I want to start off today by acknowledging the 2021-23 state biennial budget that was recently announced by Governor Evers on Tuesday night. Even though we're still evaluating the entire budget proposal and how it specifically impacts Milwaukee County, but from what I've seen so far, this proposed budget recognizes the importance of county government in Wisconsin, but also the impact local government have on the lives of residents throughout the state of Wisconsin. And so I think this budget recognizes that we are on the front lines, providing the critical delivery of services and programs to our community. And this budget provides additional tools for us to be more effective in our mission to really serve our county residents. So I want to take a moment to mention some of the investments made in critical areas such as juvenile justice, transportation, public safety, and local revenue, specifically the 0.5% sales tax option for counties, which is subject to voter referendum, a 2% increase in shared revenue. We've seen $75 million for the reauthorization of the multimodal supplemental program, an increase in general transit aids, and grant dollars for counties 911, as well as significant investments in mental health crisis services, including emergency detention, a grant program for community-based juvenile services, but as well as funding to assist counties, particularly as we attempt to shift 17-year-olds away from the dark criminal system. And so this is a really positive start to the budget process, particularly for counties. And we look forward to working with our state legislature as we move forward to secure a budget that positively impacts Milwaukee County and all counties and residents here throughout the state. And I have to say, I'm extremely pleased to see that the Wisconsin Department of Health and Services announced a $6.1 million investment to support community-based organizations in raising awareness as well as access to COVID-19 vaccine, but particularly among communities that have both been historically and currently seeing the barriers. But more than $3 million of this will go towards efforts to activate organizations to serve as trusted messengers and build confidence in the vaccine. And the remaining $3 million will supplement the vaccine equity work that is being done by our federally qualified health centers, the Aging and Disability Resource Centers, minority health grantees, and the United Way of Wisconsin 211. And these organizations are making a huge difference in our community to build the confidence in the vaccine and ensure equity and access and distribution of the vaccine. But before I hand it over, I do want to make sure that I invite everybody who's listening in to attend my virtual State of the County address that will be taking place on next Wednesday, February 24th at noon. That will be on our Facebook page as well as YouTube, and we will make sure to get those details out there. And with that, now I will hand it over to Dr. Weston. Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we have had 96,972 confirmed cases of COVID-19 in our community and 1,051 individuals who've died in Milwaukee County. We continue to see promising downtrends in cases, hospitalizations, and deaths in our community, and our percent positivity has dropped below 5%, which is a great achievement and really a testament to the personal measures taken by each of you. Today, we have Shannon Graham joining us to talk about a new addition to our county COVID dashboard. And along with our GIS specialist, Zach Swingen, Shannon is really the brains behind the Milwaukee County dashboard, working tirelessly to bring publicly accessible, transparent, and informative data to aid in the COVID response. Today, she'll be talking about a new view that we've added specifically to better understand trends in the school-aged population. It's broken down by age groups typically consistent with pre-K, elementary, middle, high school, and college populations. We saw new guidance from the CDC recently on considerations of schools, and this data, which can be broken down by municipality as well, can certainly help to inform those decisions. And as part of that guidance, the CDC stated that schools should be the last settings to close and the first to reopen when they can do so safely. So these will certainly be challenging and complex decisions that our districts and our municipalities will continue to work on and work through in the coming weeks and months. as we monitor our trends. In other news, we did receive new vaccine data for Milwaukee County from the state yesterday, and a few key items are certainly worth noting. We've seen a steady increase in vaccine supply over the first 7 weeks of vaccinations, but unfortunately last week we saw a slight decline in the total number of doses administered in Milwaukee County. It was a decrease of only a couple percent, but still certainly not the increase that we had hoped to see. We'll continue to work with the state and certainly advocate nationally for increased supply and allocation, especially as Milwaukee County has a somewhat lower vaccination percentage than the rest of the state. Where about 10% of our population has received at least one dose, compared to over 13% on average for the rest of the state. We did also see more than 14,000 individuals over 65 that did receive their first dose of vaccine last week, and now have about 36% of that population, that 65 plus population, having received at least one dose of vaccine. From a disparities standpoint, we're making slow progress on bringing vaccine to communities of color. There was some improvement on that this week, and we certainly continue to have a major focus on equity in our vaccine planning as well as distribution. And on broader vaccine fronts, the FDA will meet a week from tomorrow and hopefully move along the approval of the Johnson & Johnson vaccine for emergency use authorization. This would certainly be welcome news. The J&J vaccine is much easier to manage from a cold supply chain standpoint. It's a single dose vaccine, and it's been shown to provide 100% efficacy against hospitalization and death from COVID. And though this is slow, we're seeing progress toward ending the pandemic. And in the meantime, the most effective thing you can do is to continue to mask, physically distance, and certainly get the vaccine when you become eligible. Thank you very much and stay safe. And I believe I'll hand it to Shannon.
Thank you, Dr. Weston. Again, I'm Shannon Grauman, the Data Analytics Manager for the Milwaukee County Office of Emergency Management. Today, I'm happy to do a very brief walkthrough of a new tool that went live earlier today pertaining to COVID-19 metrics and the various school age groups. So please just give me one moment while I work to share my screen and pull up the dashboard. Okay. So when you land on the Milwaukee County COVID dashboard, you will navigate to the municipalities trend at the bottom of the page. And then you're going to click through a few pages at the bottom and land on page 3 for the school age range comparisons. So similar to other pages on our dashboard, we are now visualizing over time the percentage of COVID-19 tests that result as positive, or what we call positivity rates, and then the total COVID-19 tests administered. And those are all broken down by pre-K, grade school, middle school, high school, and college age students. At the top of the page, we have some filters provided so that if the user would like to get more specific with what they're looking at, they can. So we can refine by date range, municipality, and then school age range. And here again, you can see pre-K, grade school, middle school, high school, and college age students. So that was a very brief introduction to this new tool. We're happy to share this as one more tool everyone can have in their back pocket as we navigate the pandemic. Thanks for your time today, and Sydney, I'm going to turn it back to you.
Thank you, Shannon. Up next, we have Darren Rausch from Greenfield.
Thank you very much, Sydney. It's my pleasure to join you today from the Greenfield Health Department. As I start out today, I just wanted to talk, before we get into the data, I wanted to talk about a couple of the overarching themes. And the themes that I have to talk about today, you've heard from other speakers on this media briefing. We're very fortunate and we're very happy that we continue to see data that supports a slow and steady decrease in COVID-19 cases, both county-wide as we look at suburban health departments, but as well as within the city of Milwaukee. And in addition, we see that same slow, steady decrease consistent for our school age population as well. So I'll go ahead and share the data, but as I do that, I want to continue to emphasize to everybody that we need to continue to do everything we can to reduce our risk of disease, including wearing a mask, watching our distance, and washing our hands. So moving into a discussion of today's data, you have in front of you here on the screen, you can see the daily number of COVID cases for Milwaukee County, and we can see that continued decrease from our early spike in early January. Right around January 8th, we had a peak, probably likely due to holidays, and then a very steady decrease in both the city of Milwaukee and in our suburban communities since. And data, while pending, continues to favor a decrease as we see data in the community. When we look at death data, we do see deaths having decreased in the county, but certainly one of the things that we continue to track are deaths, because this is something that's been very common in our older adults and others that are very vulnerable health-wise in our community. So we reflect a pretty stable death rate in the county over the last several weeks, with a couple of deaths each day for both the city and the suburban communities, and those 7-day averages are trending very, very closely. We've talked many times before about our reproductive number or our transmission rate, and I'm very happy to report that since mid-January, we've seen that number well below 1, meaning that we are suppressing disease. Currently, countywide, that number is 0.8, and it's 0.82 in the city and 0.77 in the suburban communities. So we're seeing very, very similar trends. And with that transmission rate low, that means for every case of disease, we're seeing less than 1 other cases coming from that initial case. We've changed up the data a little bit, and I won't spend a lot of time on it today, but we have changed up how we're reporting the data, kind of changing the y-axis, if you will, so we can see better granularity in the differences. But as we have seen before, we continue to see more cases in the white population as a whole, but we've seen higher rates among our minority populations for cases of COVID. Similarly, we see high cases in our 25 to 39 and our 40 to 59 age ranges, but yet the most cases that we see for rates tend to impact our older populations, and certainly our older populations have had more significant hospitalizations and deaths as a result of their COVID diagnoses. So that data remains pretty consistent. When we talk about testing data, as has been mentioned before, there's a lot of testing availability in our community. We are far below where we were at our peak back in November. And so I can certainly say, as other speakers have said before me, if you need a test, if you want a test, tests are available in the community. But as Dr. Weston mentioned, even with declining tests, we're very happy to watch percent positivity and see trends heading in a negative, declining direction. Lastly, today I'll leave you with a look at where cases have occurred throughout the pandemic. This is, of course, a heat map looking at rates of disease over time, and orange and red being the highest areas. And this is what we've seen over the last 11.5 months. And when we scroll in and look more closely at what's happened over the last week, we see areas of high disease, but certainly they're not anywhere near as hot of areas in terms of new cases that we saw throughout the pandemic. So this case rate represents probably about 1/10 of what we had seen previously, but certainly when we hone in on areas, we do see pockets of high disease activity really throughout Milwaukee County, as evidenced on this map. So in conclusion today, I want to end with a very frank and transparent discussion about vaccine availability. This is the topic that's on a lot of people's minds, and it's something that we've talked about week after week. The adage that I've talked about before, that eligible does not equal available, continues to apply this week, just as much as it will likely apply to future weeks. Unfortunately, vaccine inventory is still far too small to meet the significant demand for our vaccine amongst our residents. Just looking at the data from Milwaukee County health departments, the 11 health departments for this week are only receiving about 35% of the doses we requested. This amounts for health departments to be only about 3,000 doses, a little north of 3,000 doses. Now, granted, this number doesn't include clinics and pharmacies and other vaccine providers, but I share the numbers to underscore the very limited vaccine that we're receiving, even in Milwaukee County, one of the most populous counties in the state of Wisconsin. Next week, we've received some good news, and that good news is that our requested doses will bump up. We are expecting for next week 45% of our requested doses to local health departments. And this in real numbers represents about 4,700 doses of COVID-19 vaccine. Again, this doesn't include other community providers who are doing great work in getting vaccines out to our community, but again, reflects just the limited vaccine that's coming into our communities. Secondly, I want to talk about the expansion of eligible groups. As I said previously, right now, we have an adage of eligibility does not mean availability. But on March 1st, which is just a little under a week and a half away, the Wisconsin Department of Health Services has stated that tentatively many other eligible groups will become available, or other groups will become eligible, excuse me. And this includes notably school and daycare personnel. This planned rollout, I believe, was hopeful, and it was certainly dependent on an adequate, dedicated, and predictable supply of vaccine. And this plan was put in place several weeks ago. Unfortunately, the allotments of vaccine that we've realized over the recent weeks has been anything but adequate and has been predictably far too small for the demand we're experiencing. With Wisconsin receiving only approximately 70,000 doses statewide, we're challenged as community vaccinators to complete and meet the demands of the currently eligible populations, most notably our seniors. So in saying this, Milwaukee County public health leaders have raised concerns with state leadership. Specifically, our concerns are about the availability of vaccine in light of expanding eligible groups, the lack of coordinated and consistent messaging about availability, and as a secondary to all of this, if we expand eligibility without the availability of vaccine, we would anticipate and expect a resultant frustration, mistrust, and confusion from those residents who are eligible and looking for a vaccine but unable to access it. Collectively, the local health department leaders believe in the importance of getting vaccine to our eligible populations, and we're working hard to make sure that vaccine gets out to all of you who are eligible as fast as possible. But we're frustrated by the lack of vaccine as well. When I look at our numbers, a classic case in point is our eligible group. The biggest eligible group right now are our seniors, 65 plus. The data continues to show that this population has the most hospitalizations and the most deaths as a result of their COVID-19 infection. Yet the data today, or as updated yesterday on the state website, reflects that only approximately 36% of our seniors in Milwaukee County, aged 65 or older, have received one dose of COVID vaccine. This number is far too small, and it's a bit irresponsible to think about expanding eligible groups until we can drive this number up. So I know much of what I've said has been kind of pessimistic, but folks, this is the transparent and frank discussion that we need to have. To end on a positive note, though, I do want to thank all of the residents that have been patiently waiting their turn for COVID vaccine. Know that I share your frustration. Know that we collectively on this media briefing share your frustrations. And I can say we're optimistic and hopeful that additional vaccine will be coming in future weeks and in the weeks ahead. We know that more vaccine coming to local health departments means more vaccine will be coming to community health providers. And we certainly expect those allocations to increase, especially as a new vaccine provider like Johnson & Johnson is potentially coming to market within the next few weeks. So with that, I thank you for your time and attention, and I'll now turn the briefing over to Sydney as we move into the question and answer portion. Thank you very much.
Thank you, Director Rausch. Our first question comes from Mary Jo Ola at TMJ4. DHS announced some local health departments will pilot software for the state's new COVID vaccine registry. What, if any, health departments in Milwaukee County would be part of that pilot starting February 22nd? And how do you think this will impact vaccinations locally?
Yes, thank you very much. I meet with local health departments across Milwaukee County several times a week. I know as of this morning, there's at least one health department in Milwaukee County that's piloting that program. And I know there's many others in the region and statewide that are piloting that program. I think optimistically that the registration system that's being rolled out will be a very positive thing. Many health departments across the state do not have the infrastructure for technology to do a lot of the registration and coordination work that needs to happen. Many of us have found workarounds through our electronic health records and other means. Here in the city of Greenfield, I'm very glad that we leveraged funding and dollars several years ago to bring on an electronic health record. And furthermore, that we invested some money into connecting that electronic health record seamlessly to the Wisconsin Immunization Registry. So our workaround here is a web-based survey tool that enables people to make appointments. And that data feeds into our electronic health record and feeds into the Wisconsin Immunization Registry. The statewide solution will do something very, very similar. But unfortunately, I've been doing vaccine clinics for 7 weeks for COVID-19, and I needed to find a solution that came before the statewide system was unfortunately available. But I think we've found some workarounds, and I think this more technological solution statewide will level the playing field for not only health departments, but other community vaccinators who might be interested in that system.
Our next question is from Allison Durr at the Milwaukee Journal-Sentinel for Mayor Barrett and County Executive Crowley. With the B117 strain being found in Milwaukee, what additional steps are you taking to try to guard the Black and Latinx communities, which have already been disproportionately affected by the original strain, also suffering disproportionately from this new, more contagious and potentially more deadly strain?
I'm going to turn that over to Commissioner Jackson, who's been working on it directly. Commissioner?
Thank you, Mayor. So we really at this point are moving our efforts all to vaccinations, understanding that we know right now that our current Pfizer and Moderna vaccines do offer some protection to against the B117. So knowing and understanding that our goal again around making sure that our underserved and underinsured communities, Black and Latinx, we're going to be moving into those mobile sites as we talked about before, and we'll be starting to do that as late next week. We'll have a few sites already identified. So that is work that we're moving forward very purposefully into the community to address the equity issue.
And here in Milwaukee County, since the beginning, as you all are aware, that we don't have a health department, but we do understand the value of partnerships and making sure that we have not only just targeted messaging, but how do we strategically locate testing and vaccination sites in communities of color. And we know that we have to do this. And we've been advocating as well, along with the city of Milwaukee, to make sure there's a vaccine allocation to federally qualified health centers, particularly to make sure that underserved communities have access. But this also relates to making sure that we're gathering the data to better understand how we're distributing and really reducing the disparities between races as it relates to the vaccine rollout.
Another question from Allison Durr. Commissioner Jackson, I believe you addressed this, but when will mobile vaccine units be up and running? And has the city been administering vaccines at workplaces, churches, et cetera?
So right, we are going to start those vaccines next week. One of the the mobile sites next week, we really have been waiting for vaccines. So we've been doing a lot of planning and identifying a lot of sites. So I would say in the next 2 to 3 weeks, you will start to see, and happy to share it here because this will be a mode of communication to let individuals know where those sites are and how they can get signed up.
And I just want to put an exclamation point on the point the commissioner was making, that the mobile sites are effective if and only if we have the supply. And so that's one of the things that we're working with the state to to ensure that we have the supply for those mobile sites as well as for our Wisconsin Center.
And one more question from Allison Durr. Mayor Barrett, West Allis has reportedly started vaccinating homebound residents. Will Milwaukee start to do this? And if so, when?
Commissioner?
Yes, so we are looking at what resources we have available to do actual homebound visits, and we're also working with some additional partners to see how that might be possible.
Thank you. Our next question is from Patrick Palantonio at WISN 12 for Mayor Barrett and Dr. Weston. Only about 700 people were tested yesterday at the 3 Milwaukee locations. What is the reason for the lower testing numbers?
Sure, I'll jump in first. So I think it's multifactorial, certainly. I think one of the main contributors is that we see this downtrend in cases, this downtrend in hospitalizations, and now finally a downtrend in deaths. And it is certainly reassuring. We're all very happy to see these downtrends, to see our low percent positivities. It also lends some level of false reassurance that we're nearing the end of the pandemic. And I think we are, but I don't think we're out of the woods yet as far as testing. That's especially true when we have the new strain that we've found in Milwaukee County. Testing becomes as important as ever, especially for the 3 specific groups. So that's people with symptoms. And remember, symptoms can be anything from mild cold symptoms to severe shortness of breath, cough, fevers, things like that. And then anybody who has close contact with somebody who tests positive, and then anybody certainly who's referred by a healthcare provider or one of our public health departments.
Our next question is from Sharon Bajenda at CBS 58 for Dr. Weston. How do new variants that could evade the immune system pose problems with reaching herd immunity? Could the end of the pandemic be dragged on longer as new variants emerge and immune evasion reduces the effectiveness of vaccines?
So this is certainly one of the greatest concerns with the new variants is whether they could evade immunity. There's certainly, with a couple of the variants, there seems to be evidence that they can evade at least natural immunity, so that what you get from being infected with the COVID virus. It's a little more unclear whether they evade the stronger immunity provided by the vaccine, specifically the Pfizer and Moderna vaccine. The early evidence shows that maybe there's a little bit of a drop in the efficacy or the effectiveness of those vaccines, but really very little. And the good news on the Pfizer and Moderna vaccines is that we're starting at such an incredibly high level, 94, 95%. Even if we get a little drop from that, from the new variants, they're still extremely effective vaccines. So really that ends up being the way to get past this, is to get vaccinated as soon as your time is up.
Another question for Dr. Weston. With case numbers heading in the right direction, how likely is it that another surge will come?
So I think there's a few warning signs right now that there may be another surge coming. So one of the most clear warning signs is counterintuitively that our trends are going so well. We've seen throughout the pandemic that when things go very well, institutionally and individually, we kind of pull back on restrictions. We're seeing that across the country. Some states are pulling back. Certainly we hear of individuals pulling back and how careful they're being. And when that happens, we go through the cycle and we ramp up in cases and ultimately hospitalizations and deaths. The other clear warning sign is this new variant. I think when we look at our dashboard, we see all the trends going down, which is great. But what we're not seeing is that perhaps 1% climbing up to 2% of cases, that's the B117 variant. If we could just isolate that on our dashboard, I think our trends unfortunately would be in the opposite direction. I think we'd be going up in every case with this new variant. And so if the new variant becomes dominant, which we've seen in every country that it's gone to, it pretty much does in the 1 to 2 months, then we would expect an increase and potentially, as other countries have seen, a dramatic increase in our case burden. Now, we can fight this in 2 ways. One is certainly through vaccinations. The vaccines, again, seem to be very effective, even against the new variants. And the other way is just the same thing that we're all getting tired of hearing over the last 10 months, which is wear your mask, physically distance, and avoiding group settings.
One more question from Sharon Bajenda at CBS 58 for Mayor Barrett. Are there any updates on the potential federal community vaccine clinic in Milwaukee?
We continue to have conversations with them, but one of the things I want to stress is our concerns are we want to make sure if there is a site that there's a supply that goes with it, and that there's financing that goes with it, because we have capacity right now at the Wisconsin Center to do a lot more, and we're going to do more. We want to get more in the community as well. We would love nothing more than to have the federal assistance and have an increased supply at the same time. That to me is key in dealing with these numbers that are, I think we all agree, way too low in terms of percentage of people who have been vaccinated.
Next question is from Patrick Palantonio at WISN 12 for Director Roush. What was the response from the state to the concern about expanding vaccinations to more people?
Thank you. We have not received a formal response yet, but certainly let me just kind of back up and talk a little bit about the background of this March 1st date. I believe it was in late January where the State Department of Health Services had indicated that these would be the next eligible groups, and they would be eligible tentatively starting March 1st. And one of the things that we knew at that time is that March 1st seemed a long ways away. And certainly we were hoping that additional vaccine allocations would come in that would make those eligible groups very likely to be able to get vaccine on March 1st. Unfortunately, what we've seen over the last several weeks is vaccine allocations that have been predictably low and not enough to get enough of our seniors vaccinated, that most eligible group right now and the largest group for many of our communities. So it's important to note that not only are Milwaukee County public health leaders asking these questions of the state, can we push back those eligible groups, but many other health departments across the state have been asking those questions as well. And so now that we're a week and a half away from March 1st, and it's very real that other groups might be eligible and we don't have additional vaccine, it's becoming a little bit more important to get that message out there and to make that change. So while it's tentative, we certainly hope that there's a possibility to educate, inform, and maybe even push that date back until a more reasonable, adequate vaccine supply comes in.
The next question is from Sari Lusk at the Milwaukee Business Journal. For anyone, to what do you attribute the lack of or the inadequate vaccine supply, and why are you calling on the state to who are you calling to fix it? Federal authorities or state authorities?
I think the second half of that is we're calling on everybody to fix it. It starts at the federal level and at the state level. One of the things we've stressed over and over again is in terms of health rankings, Milwaukee County ranks 71st out of 72 counties. Last week, we were 64th out of 72 in the allocation that we got on a per capita basis. So we need additional help from the federal government and the state government both.
And I could
Go ahead, County Executive.
I couldn't agree more. That's it.
Yeah, I think this is a question where we're calling on a lot of levels of government to provide resources, but unfortunately, vaccine needs to be manufactured. It needs to be packaged. It needs to be shipped. And I don't think there's a light switch that can be turned on that can pump out millions of more doses across the country. I'm very reluctant to believe that Milwaukee County in the state of Wisconsin is unlike any other state in the country. So I think vaccine limitations are all too common across the US because the supply has been limited. And certainly, I think one of the biggest game changers for supply will be the onboarding of the Johnson & Johnson vaccine, should that get approval next week. So hopefully in the coming weeks, we can enhance that vaccine allocation through the addition of another vaccine provider, but certainly we know that capacity of Moderna and Pfizer is hopefully going to be ramped up a little bit over the next several weeks as well. So I think it's just an unfortunate situation of supply and demand, and the supply isn't there because it's being manufactured and we're using it as fast as we're manufacturing it.
Our next question is from Mary Jo Ola at TMJ4 for Director Roush. Do you happen to know which health department in Milwaukee County will pilot the state software?
I do. And with permission, the Wauwatosa Health Department said, Mary Jo, that you can reach out to them and talk about them further. I don't know how far along the pilot is, but the Wauwatosa Health Department was one of the health departments statewide that raised their hand to help with the pilot program.
Our next question is from Chuck Kornbach at WUWM for the mayor and county executive. What did you hear from President Biden Tuesday in way of vaccine supply?
I don't think that we heard anything different than we heard during the town hall. I think the president wants to make sure that we can get as many vaccines in the arms as possible. And so, vaccines are coming. We have to be patient. But as Director Rouse was explaining, we also have to wait for, the virus to get in bottles, to be packaged and shipped. And so, we are eager to receive as many vaccinations as possible. But it was, nothing really different than we heard than what you all heard during Tuesday's town hall.
And it was clear to us that this is his number one priority, that he is working on this as much as he can, and they're trying to get us the supply increase as fast as humanly possible.
We have just a couple more questions left in the queue from Patrick at WISN 12. I believe we might have addressed this, but I'm going to go ahead and ask it anyway. The state says Milwaukee could be a FEMA vaccine site. What do we know about that? Where will it go? And when would it start?
Again, we've had conversations. That's all we can report right now.
And one more question from Sari Lesk at the Milwaukee Business Journal for Commissioner Jackson. How will the presence of the new variant factor into your approach to setting health orders? We're about halfway through the period of the newest order before you said it could first be up for review. If trends are still going in the right direction when that time comes, how do you also factor in the presence of the B117 variant?
So I can share with you that the new variant and all of the variants that are coming into play now become a huge factor that we use to guide us and make our decisions. That B117 and other variants become absolutely a space where we look to say, how do we then move forward as safely as possible, understanding that this new strain is coming and it's here actually. So we move forward very cautiously.
And it looks like our final question is from Allison Durr at Milwaukee Journal Sentinel. How does a third vaccine add logistical complexity to vaccinators' efforts to provide vaccines?
So the newest vaccine that'll presumably be coming out will be the J&J vaccine, and there's certainly some benefits to it. It's much easier to handle and to administer. It's a single dose. You don't have to think about 3 weeks or 4 weeks out giving a second dose. And it'll help with the volume issue that we all are certainly talking about, and the community is certainly feeling. The slight downside to the Johnson & Johnson is there's not quite as high efficacy, it seems, as the Moderna and the Pfizer. The overall efficacy is about 66% to prevent moderate symptoms, but then it's closer to 90% for severe symptoms and 100% for hospitalizations and deaths. So there's benefits, there's some slight downsides, but overall, we'll certainly welcome another vaccine into the mix.
And just a couple more questions have come in from Christina Van Zelst. Have there been additional cases of the B117 variant found since Tuesday or other variants?
We have not found those anything additional for the city of Milwaukee lab.
And one more question from Sharon Bajenda, Commissioner Jackson. Would you say Tuesday's Bucks game was a success in terms of compliance from the audience?
Yes, I do think it was. We were invited, the city health department inspectors were actually invited to participate in the game, not in the game, but to be a part of the efforts to make sure that compliance was appropriate. And we also will be there on Friday as well. And so we did see compliance. I think what we are overall seeing is individuals want to get back into doing things that they enjoy and are willing to make sure that they're following the guidelines. To do that. And we also see very good efforts from the Bucks to make sure that the plans that they put in place are being followed.
And I think the Bucks could have used you Tuesday, Commissioner.
All right. One more question. It looks like if anybody else has any other questions, please be sure to put them into the chat. This one's from Patrick at Channel 12. Commissioner Jackson, where do the Brewers stand with their safety plan right now?
So their plan has been submitted to us. We did receive it. And so we are in the process of reviewing that, and we'll be having our regular meetings with the Brewers to talk about their plans. And as the mayor had shared before, There are many conversations that happen before we get to a final plan. So we'll start those conversations next week, actually.
All right. Last call for questions. Okay, I think that's it for today. Thanks everyone for joining us. We'll be back here again next Tuesday.
Thank you all.
Thanks, everyone.
Thank you.